Been quite a morning, some really amazing content and material. In this breakout session, as the title on the screen says, we're working to address the collaboration that helps to bridge the healthcare system and church divide. So over the years here at Loma Linda, I've had the privilege of working in three different contexts. One is the healthcare setting in the chaplain's office at the medical center. A second wasn't here in this building at the time, but it is now, the School of Religion. And then the third is at the church. And I think one of the things that has struck me over the years in kind of watching what happens in each context is how easy it is on the same campus to live lives that are worlds apart. The first time moving from the medical center to Griggs Hall, where the School of Religion was at the time, it was probably a couple hundred paces. And I didn't see anybody anymore from my previous world, just absent, gone. The next was moving from Griggs Hall to the University Church, which was about half the distance. And again, didn't see anybody. It's as though the previous world had just disappeared. And that's not just in terms of the busyness of life and in terms of the different nature of the work in each setting. But it also is, I think, as the title says, there is a divide. There's a divide in terms of how church and healthcare and even academia go about their business. And sometimes never the twain shall meet. And it's been rather distressing and disturbing to see how challenging it is to overcome that reality. But on the other side of that coin, it's been very encouraging to see some of the things that are happening and what is taking place as work is happening in all three entities to try to help bridge that gap and bring them together. And that's what we want to talk about today. So we have several different presenters, several different people who are doing work in different ways and in different areas. And it truly energizes and excites me to see what is happening to help bridge that divide. I want to say thank you in a very special way to Dr. Saúl Barceló. Dr. Saúl has worked really hard in a variety of different ways to help bring this about. Saúl, I know you have some introductory comments as well.
Before we highlight, our presenters, just wanted to start kind of warming up the conversation by mentioning one of the most influential Latin American thinkers of the 20th century, Dr. Enrique Dussel. And in his book, Ética Comunitaria, which is translated to Ethics and Community, he highlights that literally, as we come together, we have a responsibility to the other. And other thinkers, think of Levinas and other great, philosophers, ethicists, have also highlighted in their work that responsibility to the other. What's interesting about Dussel is that he begins by looking a passage of scripture, which all of us have read at some point. Maybe some of us have prepared talks, devotionals, maybe even paid attention. This passage of scripture begins in Acts chapter 2, verse 42 to 47. And Dussel refers to verse 42 as a highlight of these concepts, of bringing these concepts together. First of all, building fellowship, a better translation, and he suggests communal life, a community. And I realize that for our community or for our society, this is a difficult concept. We place more importance in individuality. We also, if we're going to come together, we are asking, what can you contribute to the team? We talk about productivity. We talk about, obviously, we want to know who you are, what you have, so before we bring you in. And it's interesting, Dussel actually pushes back against this Eurocentric view that, my value is based on my accomplishments. I think, therefore I am. And he says, no, you are when you are in relationship with somebody. When you're in community, that's where the value. That's when you begin as a person. not based on the accomplishment, not based on your contributions. Again, a concept that is difficult to understand within our own community, but he continues to highlight the book of Acts as the beginning, perhaps a model that we can use. And we have tried at times a model, again, that it maybe it does not align with what we see in us, at least in North America. One other aspect of this community is that this community has a responsibility of the other. As you can see, just verse 42, it says, breaking of bread and prayer. They came together, they built this community. And most of us keep thinking of communion. Most of us thinking of the sacraments that we celebrate once a quarter, very systematic within our churches. But no, in this passage, if you read it in context, people are coming from all kinds of backgrounds, trying to understand what it means to follow Jesus, but also to live in community. And as they come together, obviously there are needs. And they will address their needs with breads. Again, because in our community, sometimes we have a hard time thinking. I'm going to refer to some communities in Latin America. If you're from Ecuador, Dr. Belliard, you're familiar with this concept of sumac causai, which is translated in Spanish, buen vivir. In English, it's a very limited translation, living well. Perhaps this idea of wholeness, which we try to embody here at Loma Linda. Professor Catherine Walsh, in her book, The Coloniality Concepts, Analytics and Praxis, explains this concept as it's understood as a harmonious interrelation or correlation of among all beings, human and otherwise, and with their surroundings. Included in the relations are water, food, culture, and science, education, housing and habitat, health, work, community, nature, territory, and land, economy, and individual and collective rights, among other areas of interrelation. Living in community includes all these aspects, and again, is perhaps difficult for us to understand. And as the book of Acts highlights, is that not only as we come together, we realize that we have a responsibility to the other. How do we meet that responsibility or that need? Well, if you look at the Christian concepts, or if you look at of the early church, they were actually influenced by three current thoughts that address one thing, that everything in the physical was supposed to be ignored, and perhaps it's been embodied in our communities of faith, in our theology. We think of the afterlife. We think when Jesus comes, we'll address it. He'll fix it with everything. Back then in Acts chapter 2, they were influenced by the Indo-European mentality and Greek, school of thought that says, the body is evil. Again, even Hindu and Buddhist, philosophy were saying you got to find liberation. And also Gnosticism did ignore the physical. You had to address the spiritual. Yet in the book of Acts, they're highlighting the most important thing, the physical needs of that community. By breaking bread, by sharing from what they have. Again, breaking bread, we highlighted yesterday briefly that breaking bread is not just like, let's see what's in the fridge. It's a thoughtful act. It takes time, effort. You didn't have microwaves. Again, breaking bread, you're using whatever you have to address the need of other. Professor Mendez Montoya, in his book, The Theology of Food, highlights the importance of addressing the needs of others with food. And again, we think of more than just food, the physical aspect. He says, to nourish implies a movement beyond the self in order to respond to the other's hunger. And in this act, create a space of true coexistence that reveals new meanings of the self as being constituted by the other. The Spanish term convivir, which is twofold notions, to live and with. It means to create a communal space, which is narrated by the gesture of hospitality that offers nourishment to the other. In creating a space of convivencia, alimentation enacts as a dynamic of gift exchange, is giving, receiving, and returning the gift in gratitude and friendship. For that reason, as we continue looking at the book of Acts, we'll realize verse 34, there was no needy people. They understood those concepts. But what about us? addressing the physical needs. It's, through bread, through clothing, through these things. It's not the only thing the early church did. In fact, that the reason we exist as healthcare systems is because of Christianity. In this amazing book that I like to use for some of my ethics class, the author does say that Christianity, and I think all of us know this, Christianity has been interested in healing from its very beginning. In memory of Jesus, it could hardly have been otherwise. Jesus was, after all, a healer. So it's not just the physical bread and clothing, but also bringing healing. His healing miracles were token of the good future of God that he promised, the future that he called the kingdom of God. In that good future, as one early Christian missionary put it, God will wipe every tear from their eyes. Death will be no more. Mourning and crying and pain will be no more, for the first things have passed away. We'll be out of business. That future was not yet, of course, but Jesus had made it known and made it present in Jesus and his works of healing. That good future had made his power felt. Remembering Jesus and hoping for the good future. I love this. Christianity entered the world as a religion of healing. Wow. During the pandemic, I read this article, and perhaps there were similars, all over the place, highlighting that, actually Christians have been dealing with major crises, catastrophes, and they have come together to address the needs of others. In this article, the author Stone says that the Christian response to plagues begins with some of Jesus' most famous teachings. Do unto others as you would have them to do unto you. Love your neighbor as yourself. Greater love has no man than this. He should lay down his life for his friends. But plainly, the author says, in the Christian ethic in a time of plague, consider that our own life must always be regarded as less important than our neighbors. But now, as we start moving away from the pandemic, we go back to our regular, schedules. We begin to prioritize other things. Last year, I read this article that even though it's in the context of the Jewish faith, the author is preparing their community to just think of Passover, what it means to them. And what I thought it was interesting is how she says, you know what? Yes, in ancient times we talk about plagues, but we continue to have plagues today. The question is, how are communities of faith addressing them? She suggests 12 plagues of injustice and inequalities, and we won't have time to address them all, but some of the presenters will refer to them. Anti-Semitism, different forms of racism. I think we begin the conversation this morning. Poverty, abortion restrictions, human trafficking, voter suppressions, attack on LGBTQ plus children, war in Ukraine, climate change, healthcare inequalities, gun violence, broken immigration system. How are we addressing these plagues of injustice? This morning we have a couple examples, and Pastor Randy will share a little bit more as he introduces our next presenter.
So as I think about what Saúl is sharing, it's inescapable to say then that those of us who are part of a religion of healing, those of us who are part of both healthcare and the church setting, have to be concerned and deeply concerned about sharing our bread and what we have with others. And so the question becomes, how do you do that? How do you wade into that? And how do you bring the three entities together? Linda Mendez works in two capacities. I'm privileged to work with her in two ways. One is at the University Church. She is the pastoral director for our outreach ministry. And I'll have to tell you, it is a vibrant and growing outreach ministry. My hat is off to Linda and to her team for all in which they lead us. But she's also working out of the Office of Spiritual Life and Mission here at LLUH as a liaison between church and community outreach. And Linda has been kind enough to agree to share some of what's happening in that area and some of the things that she is leading us in our endeavors to bridge the divide between the different worlds, and in doing so, make a significant and real difference in the lives of those who need it. So, Linda, thank you so much for being here.
Good morning. part of my job that I like is that it's hands-on and behind the scenes. And so when Randy said, would you present? I thought, oh, that's the part of the job I don't like. But we will get through it. As I speak, you guys will see a video that will just roll on. And it's partly, it'll showcase what we're doing and what I'll be speaking to you guys this morning about. But you can stay. Yeah. So essentially, as Pastor Randy said, my job is to, in the church setting, is to try to create ways in which we can impact the community, but also get our church members involved in those programs for the community. And then my job for the university is to find ways in which LLUH, our church, and the community can all collaborate, but especially create ways in which we can impact the community using the resources that we have. And so that's what I do. In March 2020, you guys know what happened. The world shut down. And for you guys in the hospital settings, you guys know how isolating that was and how restricting everything was. For what I do, one of the things that we quickly became aware of was our unhoused population had nowhere to go. And while we take care of the homeless population at our UReach office here across the street, we weren't seeing them that often. They would occasionally come sometimes when they were discharged from the hospital to get a bus pass, to get some food and things like that. But it was occasional. When the pandemic hit, we were seeing them day in and day out. They were coming. And they were coming from the hospital. And when we would say, well, what were you in the hospital for? They'd say, nothing. We wanted a bed. We wanted to get out of the streets. We wanted to sleep. We wanted food. And so it really forced us to start thinking about another pandemic that was happening that wasn't COVID, and that was homelessness. And so we decided to bring our resources together and see what we could do as a church. And so we gathered some university students, we gathered church members, and we decided that we would start going out to the streets and just taking care of the unhoused population. And to begin with, we started making masks. We have a quilting ministry at our church, and we asked the quilting ministry to make masks. We asked our church members if they knew how to sew to make masks. If they didn't, to learn how to sew to make masks. We collected hygiene kits, hand sanitizer, things like that we could take. And we just started roaming the streets of San Bernardino looking for homeless populations that we could give masks to, hand sanitizer, and things like that. As we started visiting the encampments and getting to know the homeless population, we also started realizing that a lot of people had lost their jobs, which meant they had lost their homes. And we were seeing families sleeping in their cars, sleeping in tents in the parks. And we quickly realized that the method we had created wasn't going to work lengthwise. We needed to readjust our vision. Our mission at UReach is based on James 1:22 that says, be doers of the word and not just hearers. And we really wanted to put that in practice. And so we thought, well, how do we really become doers of the word? What does that look like in a community like San Bernardino, where homelessness is growing by the minute? And so we thought, well, let's dream a little. Let's take what we've learned from our friends and start listening to what it is they need. And aside from housing, one of the things that they continued to say was, we haven't showered. We haven't showered. The shelters are closed. We don't have food. We can't shower. And so we said, let's get a shower trailer. What would that look like if we could have a shower trailer? And so I came to Randy and I said, Randy, could we get a shower trailer? I don't know that we have the money. They're quite expensive, but would you support me if I share that vision with the church? And he was behind me. We shared the vision with the church. And one of our retired doctors from our community that had worked for our institution here was in the audience that Sabbath when I shared the vision, and he gracefully decided to give a donation for us to be able to purchase the shower trailer. And so I think you've seen it on the video. We were able to purchase a shower trailer that has 4 showers. It has toilet, it has the shower, it has a sink. And so in there, they can get what they need. A warm shower. It has AC for the summers. It has warm water. It is self-sufficient, so we can hook it up to water, or we can fill up the tank and do a number of showers that way. But one of the things that we started doing as the shower was being built was we started reaching out, because we knew that UReach alone, our church alone, wasn't going to be able to do it. And so we thought, how can we get other people involved? How can we make this successful? And so we started reaching out to other churches to see if they would be interested. If they had food pantries already going, we said, let's reach out to those churches. If they had homeless ministries already established, we said, let's reach out to those churches. And so that's what we did. And in the course of a year, as our trailer was being built, we started starting these clinics where we just provided haircuts, hair washes. We provided clothing, undergarments, feminine hygiene products, and things like that, because we felt it was important to create a rapport with our homeless population, so that by the time the shower came, they felt comfortable, they felt secure, in order to be able to utilize the showers. And so that's what we did. We've currently partnered with San Bernardino Spanish Church, which is where our biggest clinic is housed. It's downtown San Bernardino, a block away from where the majority of our unhoused population lives. And so there, we not only serve the unhoused population, but the low-income population. And so we have partnered with Dr. Belliard's department, and they give us diapers for our families of low income. We provide, like I said, hygiene kits, clothing, shoes. All these things are things that are donated by our church. And so we've partnered with Kansas City Church in Riverside, Kansas Avenue Church in Riverside. We've partnered with Crosswalk. They feed the homeless on Thursday nights, and we provide the showers and the clothing and everything else. But we also thought just partnering with churches is not going to make a difference. We want to be able to grow these clinics. And so we decided to reach out to the city of San Bernardino and see if they would be willing to open their parks to us, because you need permits and permission from the city to be able to access water and dump and all that other stuff. And so the city of San Bernardino has been gracious enough to open their doors to us. And so we've partnered with them, and we are at the largest unhoused park in San Bernardino called Second Park. And we host a clinic there on Fridays. 2 Fridays ago, we were there and we had 60 showers. 60 showers. And that's just in a matter of 8 a.m. to 12 p.m., 60 showers. Showers are cleaned and disinfected between every shower. We want to make sure that they feel like they're being protected and they're being cared for. And so we do that. And the showers are all run by university students and church members. So they volunteer their time and they come out and they check our clients in. They help them with getting their clothing or their hygiene kits or anything that they might need. But the other thing that we've also done is, as we were checking some of these individuals in, we saw that a lot of them not only have mental health issues, but just health issues in general. And so we thought, what can we do to be able to take care of them in that sense? And so we reached out to our university, And we said, what could you do to help us with this? What can we do to collaborate? And so we've partnered with the School of Medicine, who has a mobile clinic. And starting this summer, their students will be participating and coming to our crosswalk and our San Bernardino clinic to start seeing patients so that they can be seen that way. One of the other things that we also did was that we partnered with the Desmond Dawes Foundation, and that serves veterans. And so any veteran that comes, if they've lost their dog tag, we can ask for another dog tag so that if they're in need of medical care, they can go to a vet hospital and be seen and taken care that way. And so this is one of the ways that we've been able to partner with the university, with our church members, to be able to impact the community. The most recent way in which we've been able to partner with our university to impact the students in our community is by opening a student pantry. Loma Linda is a blue zone, as you guys all know. We take pride in that because we believe that healthy eating is important, a healthy lifestyle is important. But we realized that somewhere along those lines, our students weren't being as healthy in their eating habits. We realized from our students and from some research that a lot of our students were suffering from food insecurity. And we thought, well, that's not okay. And so we've partnered with the university, and we last Monday opened a student pantry here on campus. We've once again partnered with Dr. Belliard's department, and they provide fresh produce to us that we can have available to the students. Our church members are donating their finances so that we can provide other food items. We've partnered with companies like Amazon, who is also giving us things like shampoo and laundry detergent and things like that. Diapers, we've also getting from Dr. Belliard's, because a lot of our students have children and are in need of those things. And so some of this is another way in which we've been able to partner with the university and the church to be able to serve our students in the community. While it is geared mainly towards our Loma Linda University students, we do want to serve all our students in the community. And so we truly believe that if we learn to communicate better, like Saúl said, rather than being standalone institutions, we can start connecting ourselves and building bridges so that we can utilize our resources better, so that we can make a greater impact in the community. We want to be able to be lighthouses in our communities. And that can only happen if we begin to communicate with each other and share our resources. I want to end today with a quote from Ellen White that's found in Ministry of Healing that says, "The Savior made each work of healing an occasion for implanting divine principles in the mind and soul. This was the purpose of his work. He imparted earthly blessings that he might incline the hearts of men to receive the gospel of his grace." We see it in the Bible repeatedly, right? That the way Jesus shared the gospel was not by telling you you had to repent, but by healing the soul, the mind, the body. And I truly believe at our church, we believe this, we practice this, that we need to be doers of the word, and that we can accomplish that if we start working together. And so that's what we are trying to do at UReach and here at the university.
Thank you so much. You can see why I say how excited I am by what Linda and her team are doing. I think one of the key words in what Linda shared is the word partner or partnership. This really happens in partnership. The vision is growing, and our desire is to connect more and more churches in our community with the medical center, with the university, with our local church here, because we can do so much more if we're working in community. One of the growing areas of awareness in my own life, and as I listen to my colleagues around our entity, I realize that some are way ahead on this and some are growing along with me, is a realization of what Linda talked about toward the end, and that's the food insecurity of our own students. So growing out of actually my office, not me, but my administrative assistant, an idea was born that has grown and has become one of the greatest outreaches in which our church is engaged. And it directly affects students. Dr. Carl Hafner, our VP for Student Experience, is going to share with you a little bit about something we call Wednesdays at Lucy's.
Thank you, Randy and Linda. How does this work? So I came here a few years ago after serving 12 years as pastor at the Kettering Adventist Church, where I worked very closely with Kettering College and with the Kettering Health System. And so for most of my career, I'm sitting on the church side of things. And as you had suggested, Saúl, you know, there's very much in my own life this blurring between roles, and I think that's the best way to do life together in community is to kind of blur those lines between, you know, church and school and healthcare system or hospital. So when I came here about a year or so into it, some church members with Janine and others started to feed students on Wednesday nights. And up until that point, after moving here, I really didn't know how I wanted to be involved in the local church. I'm a member here at the University Church, and there were certain invitations for involvement. And it really wasn't until I sat with some of the leaders behind this Wednesday evening feed for students that I said, okay, God, that's where I want to be involved, more as a church member than as an employee of the university. And so basically, you know, we sent out on Instagram this invite to students, and that's kind of how it was born. And what I love most about it is it really does address whole person care, which you hear a lot about that around Loma Linda University Health. But it really not just addresses the physical need for students to eat, but it really touches in, I think, profound ways, our spiritual needs, our social needs, our emotional well-being, all of this. And so when you think about Maslow's hierarchy of needs, yes, this obviously starts at the base of his pyramid with the physiological needs that we all have for food, but it really goes much deeper than that and addresses, you know, the need that we all have for belonging and community and spiritual health and so on. I read a report that a couple of students from the School of Allied Health Professions published a couple of years ago now, I guess it is, that suggested on our campus, 41% of students are food insecure. And Linda and Randy both alluded to that, but you just think about that, 41%. And I really did not believe it was that high. And so I started, you know, talking in committee meetings and so on, and I really wanted to do something from the university side to address this need. And so I went with our student activities director to several of the community universities and colleges in this area to see what they're doing with food pantries and to address food insecurity on their campuses. And to be honest, it just really, I could not get traction. And I was running into all kinds of roadblocks. And it really wasn't until the university partnered with the university church and with a lot of volunteers in the church and the hospital that, you know, when we started working synergistically together, that's when we started to see this come together. So Wednesday nights, you know, students are welcomed, and just a few pictures from what's going on down there. And then one of the things that started to happen is in the back of the fellowship hall there, we would set up tables, and it started in this picture. You can see church members like Dr. Hart would send tomatoes from his garden, and just church members would, send us oranges and apples, whatever, from their groves and so on. And we just put it out and said to the students, if you want some of this food, just take it. And it just kind of blew my mind that then that grew into where for a few months we had this resource. And I think we want to continue working together with JC and Linda and others, because right now we're not able to get this produce delivered on Wednesdays. But even when in the heyday, when they would just bring in, a half truckload, a small truck of fresh produce. And I remember one time they brought, like 6-7 boxes of parsley. And I'm like, parsley is fine. I have nothing against parsley. But I said, there is no way we're going to get rid of, because each box was stuffed with all of these, what do you call bunches of parsley. And I was just amazed. All of the parsley was gone, as was everything. I understand avocados going first, but parsley, really? And then one time they had turnips, which I was sure they would never go. But you can see this is just like one night, all of it was gone, which really sort of solidified in my own thinking that this is a huge need on our campus. So that's kind of been part of it. I think this is the video that just kind of gives you a view real quickly of what it kind of looks like. I love all of these volunteers from the church. I love and I always have 30 plus years of pastoring, just intergenerational ministry. Was that it? Okay, so this gives you a picture of what it looks like on a typical Wednesday night, and just the connecting. I love that as well. One of the things that we're doing right now is we're working with an IBM consulting company called Simpler, and so part of that, I am doing voice of customer interviews with students to just have them tell me about their experience here at Loma Linda University. And time and again, I'm hearing students say, one of the things I wish is that I could meet other students from different schools. I'm in the School of Allied Health, let's say, and I never meet anybody from the School of Behavioral Health or School of Medicine or whatever. This is a great opportunity for students to meet not only classmates from other schools at the university, but also what I love is it's a wonderful way for them to connect in meaningful ways with church members. And, a couple of weeks ago, Randy, we had the one-day retreat that Mark Roberts had talked about, finding purpose in the third of life. And what keeps people alive after retirement is if they have some kind of meaningful purpose to fulfill, a reason to get out of bed. And this is what I see with a lot of the retirees at the church who come week after week and set up all of the tables and provide the food and serve the food. And so there's just a lot of profound connecting. And so this, Linda had mentioned just last week through UReach, we've started this food pantry, or they've started the food pantry. And again, I talk like I'm doing nothing. Basically, when I give devotions at the Wednesday night suppers. And again, we, connect on a spiritual level. They can submit prayer requests and so on. But I always introduce myself as a volunteer from the church. And so this is really church sort of driven, but I'm excited to see it's finally coming to fruition. It's right next to the Loma Linda Market. It has refrigeration there and plenty of space. You can see we don't have lots of food there yet, but we'll continue to work on it. So it's very much a work in process. And some of the times students will write these notes to the volunteers on the table, the paper tablecloths there, and you maybe can read some of them, but basically they all kind of have some variation of thank you. So I thought I'd close it there and just say thank you to all of you for the privilege of working with you, and I'm excited about how it will continue to grow.
Thank you so much to Carl. It just energizes me. One of the greatest pictures I have by the way, Wednesdays at Lucy's, our acronym LLUC, Loma Linda University Church, that's Lucy's. So that's Wednesdays at Lucy's. But one of the most energizing views is to see students walk away, every one of them carrying a very full bag of healthy produce. So they had a great supper and now they've got all this healthy produce. I just have loved seeing that. So Saúl, let me turn over to you for the next two.
Our next presenter is someone that you met yesterday, Dr. Belliard, also known as JC. He is our Assistant Vice President for Community Engagement and Diversity and the Director of the Institute for Community Partnership here at Loma Linda University Health. What's more important is that he is a clear reminder of why we're here. That's really, as he shows up to a meeting, he will make it relevant and remind us why we have resources, knowledge, and what we should be doing about it. He'll literally open the window and tell us, this is where you need to be going. Dr. Belliard, we're excited. I know you're going to be sharing a little bit more, perhaps related to what took place in the pandemic and how communities of faith partner up with Loma Linda University Health.
Thank you, Saúl. So for my part, I want to paint a picture. It's a dark picture of the pandemic. It was like a storm coming, right? If you remember, we're starting to forget way too quickly what we just went through. For those of you who journal, hopefully you can go back and look at some of those notes. But the storm was coming across the Pacific. When it was in China, there's some concern, but it was over there. And then we started seeing cases in San Francisco. We saw the big outbreak in Seattle with many deaths. And then we knew it was serious. I remember our son was finishing his last year at Walla Walla. And I remember getting on the phone with him in March 2020 and telling Nico, I said, Nico, mijo, you have to get home quickly because the state borders are probably going to start closing because of this. Oh, no, it doesn't seem that bad up here. I'm like, just trust me. Drive home, put your stuff in the Mama Missile, his old Sienna that he had in college, and just get home. And he got here just in time before everything started shutting down. During that time here on campus, we were having discussions about, the hospital was starting to feel the effects. It wasn't quite hitting the hospital yet, but we were having discussions on how to prepare and, are we ready for this? And then the tsunami hit and the hospital was overwhelmed with cases. We had portable morgues right out here in this parking lot. I remember many people didn't know what they were, but there are many bodies there being stored because we just couldn't get them buried quickly enough. When the vaccine finally came through, public health folks up on the hill, you could probably hear a cheer up there. It's like, we finally have a vaccine, but how are we going to get it into people's arms? So leadership decided that the Drayson Center would become our mass vaccination clinic for the county. And there were others, but we were the largest mass vaccination center for a very long time. And within 2 weeks, we organized, I mean, this was a lot of sleepless nights, organized a whole team under the leadership of Dr. Hogue, who is currently the Dean of School of Pharmacy and is actually leaving us to be the president of the American Pharmaceutical Association or School of Pharmacy Association. And in 2 weeks, my team was asked to be in charge of coordinating volunteers. And they said, we're going to have anywhere from 1,500 to 2,000 people a day coming through the Drayson Center for vaccines. And my team was in charge of recruiting volunteers for that. Where do you go for so many volunteers? Now, students came to mind. It's like, students would be great, but students are in school. And, some of them might be required to come, and we can make that work in some ways, but not everyone can. And then we looked around and we said, we have a wealth of churches. And I remember sending an email out to Randy and to Tim and to some of the largest churches in the area and said, we're going to need as many of your church members to volunteer for this. And the churches came through. I mean, it was amazing how many volunteers came. One thing we have wealth of is retirees in this community. And retirees have gold with them, and that is time, right? El tiempo es oro. Time is money, I guess, in English, or time is gold. Well, a lot of retirees have time, and that's what a lot of us don't have who are still working, right? So we had many people come out and volunteer. Like I said, over 100 volunteers a day. When we first opened our iVolunteer app, we got overwhelmed. Within a couple hours, it was full. And when we started looking at where the volunteers were coming, we definitely saw our church members volunteering, but we also found something else very interesting. People were coming from LA County and Orange County to volunteer. Now, this is at the very beginning when the only people who could get vaccines were elderly, right? But if you're a volunteer, you could get a shot. So we counted in our first wave 400 volunteers from LA County. And I met some of them, and there were movie producers. There were people from West LA, not East LA, Malibu, just swarming out here to volunteer at our clinic so they could get their shot. So we had to make some adjustments there to who can volunteer and why they're volunteering. So I know you're probably very familiar with this image of the difference between equality and equity. And what we started with our mass vaccination clinic was an effort at equality. We opened up this mass vaccination clinic for anyone who wanted to come and get their shot, but you had to be able to come during the day, mostly working hours. We went into the evenings some. You also had to go online and register through the state system to volunteer or to sign up for a shot. So you needed access to internet. And we started looking at the numbers of and the demographics of the 1,500 to 2,000 people who were coming in. So this is just by age group. If you look at the Drayson Clinic, you see the largest age group was 30 to 49. The next was 50 to 64. The smallest number was 75 and above. So what we started doing is what we called our equity clinics. I said, the Drayson Clinic is not enough. It's important and it's necessary, but we need to take the vaccine to the communities that need it the most and where people may not be able to get off work to get a vaccine, or be able to get on the internet or even know how to navigate the internet. So you look at the difference in our mobile community clinics, and the Park Clinic was another Loma Linda clinic, mostly for employees. So you can see the similarities of the Park Clinic and the Drayson Clinic as far as the demographics or the age. But if you look at the mobile clinics, our largest number was very different, 65 to 74. We had grandparents coming with their grandkids and signing up right there on site. You didn't have to go online. You didn't have to, it was first come, first serve, and it was all paper based. And the other thing that helped us in doing this was our partnerships. And I'm going to talk a little bit more about this, but I want you to look at the demographics, looking at race and ethnicity. Drayson Center for African Americans with 3.8% of our people coming to get vaccinated. 53.4% in our mobile community clinics for African Americans. If you look at Latinos, 21%. In Drayson, this is in a county where we're over 50% Latinx in this county of San Bernardino, much higher in San Bernardino City. Mobile clinics was 38%. So you see it was inverted. The demographics were completely opposite from what we were seeing at the Drayson Center. So how we were able to do this was building on existing relationships. And I know that the word relationship has been used a lot, and I appreciate Saúl opening with the importance of community. We had a very strong relationship with a lot of our community churches, especially our Black churches. And we had a leader, a doctor or a Reverend Sam Casey, who's the director of COPE, Congregations Organized for Prophetic Engagement. And we would have these meetings with them, educating their church members about what COVID was, because there's a lot of resistance on behalf of the Black community for all the reasons, for the historical reasons in not trusting this vaccine. Once the pastors came on board and we talked to them about it and explained what it was and how the vaccine was researched, we brought researchers of color to explain how this was tested and tried on different communities. Once the pastors joined, and this was pastors from ICAC, Inland Empire Concerned African American Churches, a group of probably close to 30 African American churches. Once they said, we will get the shot, the rest of the church was easy. So we started scheduling these vaccine clinics at Black churches throughout the county. The very first one, and this group of African American churches chose Pastor King's church, 16th Street, Andrea King, as the first church, because they saw her as such a leader in her community. And I was so proud, and I had to explain to them, it wasn't Loma Linda that chose 16th Street. It was your community that chose 16th Street to be the first church. So we would have these meetings. So we provided around 33 community-based clinics at churches, schools, community centers, senior residential homes. For the Latino population, we worked a little bit differently, because we found that the pastors were not as on board with the vaccine as the Black pastors. So we worked through promotores de salud, community health workers, and they would go out and prepare a community, and then for the vaccine clinic, and then we would meet at a community center and vaccinate people. And it would bring us so much joy to see people from a mechanic shop across the street in their uniform, with their name, come take a 30-minute break from work, come across the street, get their shot, and go back to work and not miss any work. We had groups of women who were housekeepers at motels and hotels that would come in their uniform, get their shots, and go back in. So there are over 3,700 administered doses in the community. 250 plus Loma Linda students participated, and church members who were helping in the Drayson Center would also come out and do this on the weekends a lot of times. with us. I love this slide because it got the attention of our governor. If you don't recognize him, Governor Newsom came down and wanted, this is at 16th Street Church. And this is one of our faculty from School of Pharmacy. And this is the first woman from that church to get a vaccine. And he wanted to be there for that. And the importance of having diversity on our faculty was so important because Dr. Jacinda Mutakabir, who's now at UCSD, but was here at the School of Pharmacy, was instrumental in being on the webinars that I showed you earlier with church members through Zoom. And then later, this woman was saying, can I have Dr. Jam give me the shot? And because they had already met her on Zoom. So she was the one to give her the shot, and connecting the educational piece with the clinical piece was really important as well. So what I want to end with today is, yes, we need to bridge the gap between hospital, university, and church. And we have those silos, and we constantly work to break those silos down. But I think, just like I mentioned yesterday, in moving us from a culture of service to kinship, how can we really understand our community in a way that, like Paulo Freire said, yes, we need to understand what the needs are and address those needs, but we also need to be asking, why are those needs even there? Right. And then understanding the pain that our community, I find myself talking about the post-pandemic world that we live in. For a lot of our communities, there hasn't been a post-pandemic. They're still living the realities of having lost family members. There are kids in our schools who lost 5 to 6 relatives in the pandemic. There's a book that I recommend. I'm always recommending a book. So here's another one, Saúl, by Pauline Boss, The Myth of Closure. Ambiguous loss in a time of pandemic and change. And it talks about how our communities have gone through this really hard time. And many of us in the middle class have moved on. We're like, that's a thing of the past, when they're still dealing and coping with those things. And I think it's important for us to really have that proximity so that we understand what that is and keep asking those questions of why are there these disparities, and really address the root causes. Thank you.
Thank you. If you pay attention to Dr. Belliard, he's always going to recommend at least 2 to 3 books. So I think he's aware, because sometimes I miss the title, so I have to go back and ask him. You heard from our community how we are attempting to address the needs of our greater community. It's a work in progress. If we had more time, we would love to learn what you're doing in your own community, because we know you're involved. Unfortunately, because of time, we hopefully during lunchtime or before you go, we can maybe compare notes, see what's working, what's not working. The main thing is that we are attempting to address the need. Before we conclude, we felt we needed somebody with expertise that could help us see the big picture. How can we, as a community, as organizations, as churches, but how can we as individuals make change? Not just at a local level, but in a greater scale. And so our last presenter is Dr. Wonha Kim. She is somebody, again, with expertise. She has undergrad training in Princeton, where she majored in policy. Also, she went to medical school at Johns Hopkins, went to residency again at Johns Hopkins in pediatrics, specialized in pediatrics. But when she finished her training, she continued going through more education at the Johns Hopkins Boomerang School of Public Health, obtaining her master's in public health degree. She's a board certified in both pediatrics and public health general preventive medicine. We're glad that in October of 2013, she joined the faculty of Loma Linda University as assistant professor of pediatrics and preventive medicine, assistant professor of School of Public Health, and also senior research scholar for the Institute for Health Policy and Leadership. In September of 2015, she became the associate director. Later in 2017, when our director, Dr. Gerald Winslow, retired or transitioned into other projects, she began her role as the director, again, of the Institute for Health Policy and Leadership. Dr. Kim, thank you so much for helping us understand the big picture.
Thank you so much for that kind introduction. One thing that's left out of the bio is that it's an important aspect of my life, and that is the fact that I'm an Adventist pastor's wife. So I think the reason I fit into this panel is because my family bridges healthcare system and church right there in one. So the title for my presentation this morning that I want to share with you is Policy and Advocacy: Building a Better World for All Through Systemic Changes. I thought about titling it Building a Better World for Those in the Highways and Hedges, given our theme, but that made the title a little bit too long. So I kept it at this. So we're going to shift from these amazing stories we just heard about what's happening as church and healthcare systems and community collaborate to take a bird's eye view of what can we do at systemic levels to affect change so that, as Dr. Belliard nicely segued for me, we can change the reason why people are experiencing these sufferings in the first place. So the outline of my presentation this morning is I will start with why engage in policy and advocacy, and what is advocacy, and for whom do we advocate, and how do we engage in advocacy, and then wrap up with some concluding thoughts. So I'm in academics, so I have to have learning objectives. So here are the learning objectives that we'll end up with by the end of this presentation. First, we will understand why it's important to engage in policy and advocacy as Christians and/or as healthcare professionals. Second, define policy and advocacy and differentiate that from politics. I think a lot of people get that confused, so I want to make sure we distinguish that. 3, summarize the basics of the federal legislative process. 4, know who represents you in the local, state, and federal government. Become familiar with ways to contact your legislator and become familiar with health policy resources that are out there. And then finally, advocate for issues affecting vulnerable members of our society. So as Simon Sinek made famous, let's start with why. Why are we doing this in the first place, right? As Proverbs 31:8 says, it says, speak up for those who cannot speak for themselves, for the rights of all those who are destitute. So the Bible calls upon us to speak up for those who cannot speak for themselves. And Jesus himself, as we know, was an avid advocate for the poor, the widows, the orphans, the sick, basically the voiceless and vulnerable members of our society. And this whole conference, we've been talking about that, right? And the fact that we're all sitting here means we are in positions of privilege. And with privilege comes great responsibility, which means we are called to advocate. So what is advocacy? Sorry, looks like my slide format got a little changed, but so let me share some definitions that are out there. So according to Google Dictionary, everyone likes to Google these days, right? Advocacy is public support for or recommendation of a particular cause or policy. Merriam-Webster Dictionary calls it the act or process of supporting a cause or proposal. The World Health Organization defines it as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. And finally, the American Medical Association calls it promoting social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. And that's what we're all here for, right? To ameliorate human suffering and to contribute to their well-being. So let me kind of sparse out the difference between advocacy, policy, and politics. So advocacy, as I just defined in different ways, is a support for a recommendation for a particular cause or policy, right? So what is policy? Well, policy is a rule, a principle, guideline, or framework that's adopted or designed by an organization or a government to achieve specific goals. So of course, at the government level, we have those bills and laws, those are policies. But at an organization level, we also have things like fire safety policy, vacation policy, which we all care about, right? And so forth. And then comes the politics, the loaded word, right? So politics is activities associated with the governance of a country, state, etc. And I think oftentimes, and it is true that we cannot completely separate policy and advocacy from politics, because there needs to be a political will for a policy to actually be enacted and so forth. But at the same time, it's different from politics in that you can have evidence-based, science policy with that's good for what we need to accomplish versus the politicians and what they do for political activity. And the reason I want to definitely make sure there's a distinction is because as Adventists, right, we have the tradition of the separation of church and state. So you may be like, wait, why are we talking about policy when we're trying to separate church and state? I'm not talking about church being involved in politics. That's different. And also when we talk about separation of church and state, what we're talking about is that church should not be the governing state, right? So it's perfectly fine for Christians to be engaged in policy and advocacy because, and once again, going back to that why, Jesus calls us, right, to be advocates, to make sure our world is a better place, not just for the privileged, right, but for all, and especially for the vulnerable. So I want to also pause and say there are different layers and levels of advocacy. So when I talk about advocacy, I'm not meaning for all of us to go to DC or Sacramento or your state capitals to lobby and whatnot. That's not what I'm talking about, because there are different levels of advocacy. So first, at the basic level, if you're a healthcare professional, is the patient and the patient's family, right? So for example, as a pediatrician, I do my clinical work in the setting of teaching residents here. And there are oftentimes, because pediatrics, we talk about vaccines. So we provide vaccine counseling. And I remember a few years back, during the pandemic, actually, we're talking to a teenager and his mom, and we were recommending routine vaccines as well as COVID vaccine. And mom was kind of like hesitant. She's like, I don't know. But as we did counseling, the patient was actually, I want to get them, which is rare, right? Usually kids are like, no, don't give me those shots. But this time, the child wanted it, the parent didn't. But through advocating for what the patient wanted and giving information, the mom said, okay, go ahead, right? So that's an advocacy as well. As well as, of course, at the institution level, adoption of things like surgical safety checklist is, advocating for something. At the community level, we heard wonderful stories about the UH showers. I thought Dr. Belliard may talk about the community garden as well, but also the vaccine clinics. All those are examples of advocacy at the community level, right? And then, of course, at the government level, which is, near and dear to my heart as the director of the Institute for Health Policy and Leadership, is that we advocate for policies and bills at the government level that we know will have a positive impact on our community. So a quick example I have is a few years ago, there was this healthy by default policy, if you will, where basically for restaurants that provide these packaged kids meals, we were saying, let the default beverage that come with that packaged meal be either water or milk substitute rather than sugar sweetened beverages, because we all know sugar sweetened beverages are pushing our obesity epidemic and very bad for your health, et cetera, right? So we brought this up to the Loma Linda City Council. And we had some students from School of Public Health and School of Medicine and whatnot go and testify at the city council to be like, let's adopt this as a city. So that's engaging in advocacy, right? Later on, actually, the state of California adopted this. So good for the state. And then a reminder that advocacy is a continuum, right? So we can go from a patient advocacy, like I was mentioning earlier, to population level advocacy at the state or federal levels. We can go from grassroots activity that grows into reach, DC, or a conversation, just casual conversation, over meals with friends, to a testimony at the city hall, or some social media activity, which you have to be careful about these days, to op-eds, right? And through these, you're expanding the circle of influence by learning these new skills. So once again, a reminder, for whom do we advocate? I'm not talking about advocating for your own selfish interests, right? You're like, I want more pay or whatever it is, right? But what I'm talking about is advocating for our patients, especially the vulnerable members of our society, the voiceless members of our society. And yesterday during the plenary, talked about the powerless, members of our society as well. And so I'm going to switch gears a little bit, and sorry if it's a little too dry and didactic, but I do want to capture how we engage in advocacy. And with that comes some understanding of the basics of government. And I hope most of you, if not all of you, already know this, so it'll be a quick just overview, but just a quick reminder that there are different levels of government. Of course, there's a local government, such as towns, cities, and counties. And some of the distinctions is that counties set budgets for the county hospitals and public health programs, so that's relevant for health systems. School boards can determine various health and well-being policies, such as what's sold in school vending machines, which is critical for children's health. Towns and cities can also set budgets and pass local ordinances related to health issues, such as smoke-free areas, right? So that's the local level. And then, of course, there's a state level and the federal level, as we know. And the three branches of government, as we know, the legislative that makes a law, the executive branch that carries out the laws, and also importantly, sets the budgets. And President Biden just issued on March 9th, the proposed federal budget for fiscal year 24. And then the judicial branch that then interprets the law. And just a quick reminder, there are additional government entities to be mindful of. There are agencies, right, like the Center for Disease Control and Prevention, CDC. There are departments like Department of Health and Human Services, and they put out these regulations, right? So there are policies in terms of the legislative end, and then, of course, there are policies at the regulatory end. There are bureaus, boards, institutes, commissions, councils, and so forth. So how does a bill become a law? Once again, quick review on civics, right? So an idea can come from anyone, meaning any one of you sitting here can have an idea. But unfortunately, not anyone or everyone can propose a bill. So you have to take that to your legislator to then adopt and propose and introduce that bill in whichever chamber they sit on, right? And once it's introduced in that chamber, whether it be the House of Representatives or the Senate at the federal level, then it's taken to a committee that's relevant to that bill. And then the committee debates it. And many bills do not make it out of the committee. Once it makes out of the committee, if you're lucky enough to do so, then it goes to be voted by that chamber, right? The House or the Senate. And if it passes, which it doesn't often pass, but when it passes, it goes to the next chamber, right? So if it was in the House of Representatives, it goes to the Senate, then Senate, House of Representatives. And then they go through that process all over again with the committees and whatnot votes. And if a bill is lucky enough to be passed by both, then of course it goes to the president either to sign or to veto, right? So there are many stops along the way our bill could die. And for the sake of time, I'm not going to show this, but there's a School Rock video called I'm Just a Bill. Has anyone ever seen it? Yeah, it's got the catchy tune, I'm just a bill. Yes, I'm only a bill, and I'll stop there. But it's a really fun short clip. So if you want to, you can check it out. But it kind of goes through how this little bill, that's just a bill, goes through this process and becomes a law. But along the way, you see how things can die. So feel free to check it out. But it's a long process. Do we have time? Would you like to see it? It's a comic relief. Okay, all right, we'll play it then. I think it was that. Yep. I think it can maximum. Oh yeah.
It has to be shared.
Or you can sing it.
No. I will not sing it. We have the. Okay. Thank you so much for your help. What will we do without our IB team, right?
Sure.
I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long week while I'm sitting in committee. But I know I'll be a law someday. I hope and pray that I will. But today I am still just a bill.
Hey, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." And he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be here. Hope and pray that they will, but today I'm still just a bill.
So those congressmen are great. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm the one. I go to the House of Representatives and they vote on me.
If they vote yes, what
But I
happens?
go to the Senate and the whole thing starts all over again.
Oh, no.
Over here. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be a long time that he will. But today I am still just a bill.
You mean the whole conversation should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again. And by that time, it's so.
By that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but I hope and pray that I will. But today I am still just a bill. He signed your bill. Now you're a law. Oh, yeah.
All right. So
The hardest part about being alone is letting go.
How do we
Is
do that?
understanding, let her know you never left.
I hope that I apologize if that tune is stuck in your head all day long. I apologize in advance. It's a pretty catchy tune, isn't it? All right, thank you so much. Okay, so that's how an idea becomes a bill and then becomes a law. Some other notes about that federal legislative process is that each Congress lasts 2 years and is comprised of 2 sessions, 1 session per year. So we're in the 118th Congress that just started that 2-year cycle. Last year, we just finished the 117th Congress. And that's important to know because if a bill doesn't get passed during that Congress, then it's done unless it's reintroduced, right? So if you're looking at bills from 117th Congress, unfortunately, that's done. And well over 10,000 bills are proposed per session of Congress, but only hundreds of bills are enacted into federal law during a single Congress. So you can see many more die along the way. And only a member of Congress can introduce the bill, like I said, but any one of us can actually have the idea for the bill. And in the House, majority leadership wields more legislative power, whereas in the Senate, individual senators wield more control throughout the process, which is why you may have seen lots of newspaper articles about Senator so-and-so, is opposing, and that's making a difference because individual senators wield more power. So if you want to reach out about certain policies, probably more effective to reach out to your senators, although it's also effective to reach out to your House of Representatives. And then as the cartoon showed too, and as we know, president can either sign, veto the bill, but what you may not have known is that that's what's called a pocket veto. Okay, a pocket veto is if a president doesn't want to go on the records as either having signed it or vetoed it, just won't do anything about it. And if the Congress goes out of session in the next 10 days after that, it actually doesn't become a law. So without actually formally vetoing it, the president could just let it not become law. And alternatively, if the president does not take any action and Congress is in session for more than 10 days, then the bill becomes law without the president's signature. So there is that built into our legislative process. So where can you find information about this bill? So you may be like, I don't even know what policies are out there, right? So at the federal level, you can go to www.congress.gov. There's also govtrack.us/Congress/bills. And those are good sites to see what some of the federal policies are, and you can do word searches for certain topics that you're interested in. At the federal and state level, there's legiscan.com. At the state level, here in California, at least, there's leginfo.legislature.california.gov. And of course, it would be amiss for me as a director of the Institute for Health Policy and Leadership not to mention the resources that we provide. So we produce these monthly policy briefs that you can feel free to check out at ihpl.lou.edu. So the first step, of course, is to know who represents you in government. Does everyone here know who your reps and senators are? I see some heads nodding. That's great. But if you don't know, right, at the federal level, you can go back to that GovTrack site to type in your address to find out who represents you at the federal level. And at the state level, you can go to openstates.org and find your legislature as well. So how do you then communicate once you know who these legislators are, right? There's always, of course, that personal contact aspect. So you can actually contact your state and federal legislative representatives either by phone, by email, online comment forms. These are all available through their websites, right? Social media platforms. Nowadays, you can like tag them on Twitter or Instagram or what have you, right? Or traditional face-to-face meetings if you have the time. And certainly you can set those meetings up just by calling their office and say, I would like to meet with so-and-so. You can also do public comments by giving testimonies in committee hearings or signing petitions online or writing a blog or op-ed or other social media posts. And you can do that at an individual level, right? So because each constituent makes a difference. When a constituent reaches out, they'll actually listen. And then on top of that, if you're a healthcare professional or faith leader, you're generally considered quote unquote good, right? Altruistic, compassionate, trustworthy. So they're more likely to listen as well. And then of course, we can also communicate at an institutional or organizational level. So there are each professional organization such as the American Academy of Pediatrics that has advocacy arm. All these other organizations do. So find out what your organization has on the advocacy agenda. And you can join the organization petitions, letters. Some organizations have advocacy days that you can participate in as well. And when you do talk to them, right, we talk about these elevator speeches. And I'm sure many of you are familiar with this. It's called the elevator speech because imagine you got into an elevator, you're finally with the person that you want to talk to, that you've been wanting to talk to. So you have that 2-3 minutes while on the elevator before they depart from you to say what's on your mind, right? Which means you have to have this prepared, right? You can't just do it on the spot unless you're a great speaker. So the elements of the elevator speech is introduction. First, you got to say who you are and your role, problem, right? Explain what the issue is. Give your proposal. You don't want to just talk about the problem and be a downer, right? You want to say what you want to be seen done, and then stating your ask. And the key thing, of course, is keeping it brief and keeping it oriented. So I have a quick example here. It says, hello, my name is Wonha Kim, and I'm a board-certified pediatrician and preventive medicine physician. In our country of abundance, we have almost 40 million people living in the United States who belong to households that do not have consistent access to sufficient food to live an active, healthy life. And of those, 11.7 million are children who need access to adequate nutrition to grow into healthy adults. They're suffering from food insecurity, which is associated with increased risk of anemia, asthma, birth defects, cognitive problems, aggression, anxiety, and depression. Children living in food insecure households are at least twice as likely to report being in fair or poor health. And among other measures, HR 8450 Healthy Meals, Healthy Kids Act will expand access to school meals by expanding the community eligibility provision so more school districts can provide free meals and significantly expand the summer meal program for our young students whose only meals are through the school. Would you help feed our hungry children and build a healthier America by supporting HR 8450? So that would be like an example of an elevator speech. So think about what things you might want to be an advocate for and how you would have that elevator speech. And one example that we've been kind of talking about throughout this morning is the food insecurity. So I just want to mention a key legislation, because that's an advocacy opportunity out there right now, called the Farm Bill. So the Farm Bill is a federal omnibus bill that governs policies in matters related to agricultural sector, but it includes food assistance programs such as SNAP, or Supplemental Nutrition Assistance Program, formerly known as food stamps. And it's renewed every 5 years. And in the history of US, we've had 18 of such farm bills passed, and the last one in 2018, which means, you do the math, right? This year, we're up for reauthorization. So Congress right now, you can see from this graphic I put here, is in the steps of kind of going through and putting in what needs to be in the farm bill. Okay. And come September, we will have this new farm bill. So now is the time to contact your legislator about it, so that we do not need to, have all these students, 41%, right, who are food insecure, so that we do not need to have these, folks who are suffering from not having the nutrition that they need. So some other helpful sites for additional topic ideas. The Institute for Community Partnership that Dr. Belliard heads up does every 3 years what's called Community Health Needs Assessment, because that's required by IRS rule for charitable hospital organizations. And you can look there to see what is our communities need, right? You can also look at Healthy People 2030 goals and objectives, or the issue briefs and blogs produced by our institute, health affair articles, Kaiser Family Foundation, Stakeholder Health, and other professional membership organizations, to see, if you don't know yourself from working hands-on, what are these topics that I need to advocate for? So going back to that question of why advocacy, we're called to be like Christ, the great physician, who was an avid advocate for the voiceless and vulnerable members of our society. And policies and programs that are enacted from advocacy affect millions of lives. So I went to Bloomberg School of Public Health over at Hopkins for my MPH, and it's a little pretentious in a way, but our school motto was saving lives millions at a time. But it's true in public health, right? I'm a physician, where we save lives one at a time, right, with each patient encounter. But in public health, we save lives millions at a time. And with policy, we can do the same. And even if our advocacy attempts do not result in policy, because like we saw, many bills die along the way, that's okay, because it changes us for the better for having acted on behalf of others. So I want to close with one of my favorite Bible verses, Micah 6:8, where it says, "He has shown you, O man, what is good, and what does the Lord require of you, but to do justly, to love mercy, and to walk humbly with your God." And that is the call that we have today. Thank you.
Thank you so much to Dr. Kim, as well as to JC and Linda and Carl. We have a few moments before lunch is going to be served. We're not going to belabor the point unless there are questions that you would like to ask, questions or comments for any of our presenters on any of the themes or topics. Saúl has a mic back there.
Thank you so much for all of your presentations. They've been really awesome. I have a question for Dr. Kim, particularly about advocacy. One thing we all kind of cynically know is that politicians are motivated by more things than just the facts, right? I'm just wondering, to what extent in your advocacy work do you take other things into consideration, such as how they would look to their constituencies, or do you think about this particular politician may want to appear a certain way to their constituents, so you would tailor your approach to suit that, and to whatever extent that you might do that?
That's a great question. And I should have probably mentioned that as an academician, I focus more on the policy that helps inform those who are our partners, who then go and advocate and quote unquote lobby. So I know I put up a picture of me and Dr. Winslow when we went to DC several years ago to participate in the Advocacy Day by the Adventist Health Policy Association, which is sort of the advocacy arm for the 5 Adventist healthcare systems in North America. But the important thing is, so we of course need to have evidence-based policies with facts, and that's the starting point. But it is true, there are many other motivations than just, wow, this is a fact, let's do it, right? So it's all about the framing. So you need to know what that politician's interest is. So let's say they're interested in mental health, right? Or their constituents are mainly made up of certain population, right? So you need to approach the topic with some of that framing so that they will listen. And then once they're willing to listen, then you can also support with some of these facts as well. And in addition, stories make a difference. So, of course, in the academic community, we're about facts and evidence, but in the political world, anecdotes make a difference, right? So when we talk about food insecurity, all these facts I just mentioned may not mean much until, say, a mom comes with the story of how her children are starving, right? So that's another important aspect to consider, having those stories. And at the end of the day, like I said, it may not happen because of various reasons, including maybe it's not in their agenda or they're more powerful advocacy. But I want us to feel empowered that each one together can make a difference. Because if you think, oh, I'm just a person of one, I'm not going to do anything because what am I going to do? They're not going to listen to me. Who am I? But if everyone comes together, right, and enough constituents contact them about it, then they're like, oh, this is not something I thought about, but all the people that are voting for me or should be voting for me care. So if I don't address this issue, then I may not be voted in next time. And there's a power of that consistency. So just remember that. Don't think that because you're one person, it won't make a difference. You can.
Thank you so much. I'm really, truly, deeply encouraged by everything I've heard today. I'm old enough to remember the term that healthcare is the entering wedge, and the purpose of it all, in terms of the church, is to invite people into our community of faith, to care for them and follow with an invitation. And the sense of bridging the gulf, in my old mind, has always been helping administration in our church all the way up through the general conference level understand why it is we do the best we can to simply care for people. What I'm interested in is whether or not the things you're doing are recognized and appreciated at higher levels of the church, such that the conceptual divide, the bridge, is slowly melting away a bit. That would be really encouraging to hear. I don't know.
Was it 2 weeks ago? We had here on campus some meetings, and correct. And Elder Wilson was here and during those days. And the goal is always to serve for the sake of serving. And you never know who's paying attention. I was raised a pastor's kid, and so it's ingrained in me that everything you do, you assume someone's watching. And so you always operate from that standpoint. But that particular day, we were short volunteers at our cafe. We have a cafe here at our church that also runs through my department. And we didn't have any volunteers. 2 of our employees were sick. And so I said, well, I'll come in and help. And yes. And here I was in a hairnet and my t-shirt, just, serving drinks, pretending to be a barista. And Elder Wilson walked into our cafe, and I thought, oh no. And he came to the cash register. One of my employees served him. And as he was paying, he said, so this cafe goes to help your outreach department here at the church, correct? And I was standing right behind him, right behind the cash register. And I just went, he knows who we are. But it was a moment of, it's nice to see that at higher levels, our church is recognizing and is aware of what we're trying to accomplish, at least here on this campus. And so that was a great, for my staff as well, because, they were like, he knows what we're doing. He knows that the food we serve here goes to help the homeless population, the students. And so that is encouraging, that what we're doing, although that's not what we've set out to do, has gotten to that point where they do know.
I just have a quick answer to that. I guess I was a teacher's kid, so I don't know if we worried as much about, I don't know if anyone was watching. Probably should have worried a little bit more and would have finished high school instead of a GED. But yeah, I think my first reaction to your question is like, we're too busy to doing the work to know if anyone's noticing. I do get sometimes the question, like, how many baptisms have come out of the work that you've been doing? 28 years here working with this community. How many people have you baptized or have you led to baptism? And I think my response is usually like, well, I think about how many young people from our church have stayed in the church because of this work. Maybe not, the baptisms on that side, but I've always been amazed at the deep spirituality of our community members. I think they have a lot to teach us. And, as a community of faith, sometimes I think we're surprised at how deep the faith runs in our own community. And that's always encouraging to me. And I think our students need to be exposed to that.
My question was too, how do we bridge the gap? We have lots of medical knowledge, but how do we bring it to our conferences, to our church? And my question is, we heard this morning about Black men being increasingly diagnosed with schizophrenia and critical race theory. How does it go to the academy where critical race theory is not allowed to be taught? How do we bridge the gap between church and medical knowledge about LGBTQ communities? Where are we there?
I think it's a great question. I'd like to refer that to Dr. Saúl Barceló. No, in all truth, I think a quote that has meant quite a bit to me in recent months has been one by the writers on leadership out of Harvard, Heifetz and Linsky, who say that leadership is disappointing your people at a rate they can absorb. I think there's a lot to that, because if you disappoint your people so fast they can't absorb it, it blows up and everything ends. On the other hand, if you never disappoint your people, you're not moving, you're not growing. And so I found a lot of wisdom in that sense, that leadership is disappointing your people at a rate they can absorb, because you are moving. There are things that are happening, and yet you still manage to keep them with you. And there might be something that I think for this conversation as well. I mean, I love the quote. I was just sitting here trying to remember who this is from. It's not original with me, but I resonate with it deeply. And that is that as Christians, we go to the community and we say, we're here to serve you, and God bless you whether you ever come to our church or not. That's not going to change one iota of what we're here to ask what we can help with. And I think that kind of selfless, uninterested kind of service is really the kind of service to which Jesus calls us.
Mm-hmm. Thank you so very much for this presentation. I really appreciate the framework that you have presented in the addition of advocacy, a very intentional connection to of advocacy into serving. And Dr. Kim, I'm from Washington, D.C. area. And so when you started putting all that government stuff, I was like, oh, Lord, do we have to deal with this? But as the presentation went on, it just really hit me how that is kind of like the third leg or the second leg of service that we rarely talk about, but I am seeing now how important that is. Because if we just serve for the sake of serving and there's a need in the community, it could very easily become and move into the space of self-serving, can move into space of, perpetuating a problem, or it could very easily move into the space of sustainability. And I've seen so many ministries, great ministries, that just peter off and die because it just it just sits there. And so how can we create this framework when we're talking about service to really intentionally link it with advocacy? How can we do that better?
Thank you for that question. I think that is something that we definitely, as leaders, either in the health system or in faith system or both, to really think about so that we can be intentional, like you said. I think the first step is bringing that awareness to be like, this is great that we're doing this, but let's also think about the root causes of this problem that we're addressing through our service, right? And what can we do to address that root cause so we can have a two-pronged approach, right? So we will serve, because the need is still there until the policy goes into effect. You can't just be like, I'm going to work on policy, so let's just let the need be. You still have to address that need. But while addressing that need, also think about how can we address the root cause that created this need in the first place so that, in a way you're getting yourself out of that work, right? Because you're going to try to address that issue, but do it so that either by supporting a policy that's already out there, right, that address that issue, or like I said, an idea can come from anyone. So you can work with maybe people who have the facts or whatnot to form a policy idea to take to your legislator and be like, we see this on the grounds as we serve our community. Can we get this policy in place? And, I'm going to be realistic and say, it's not always roses, right? That you will be met with resistance and whatnot, but it's that persistence, right? And it's that higher calling within us. I think that will give us the strength to continue when we meet those barriers. And so I just want to encourage you to start having these conversations now that you've been here with your team, with whichever team you serve, and think about how can we go beyond what we're currently doing in the service part and address the root causes that are causing these issues in our society. Does that answer your question?
I just wanted to add to that, because a lot of times there's this false dichotomy of, well, do you serve or do you do policy? It's like we need both. It made me think of Paulo Freire, a Brazilian educator and philosopher, who said, he did a lot around adult education for the illiterate Brazilians. And he said it's important to teach people how to read and write, but just as important as it is to teach them to read and write, it's important to have them understand why they don't, as adults, read and write. So I think that's really when we're addressing food insecurity, which we do on a weekly basis, with Linda's team and our team with produce distribution, diaper distribution. There's a side of me that says, this is just putting a Band-Aid on things. But when you go and do it and you see the people who receive it and say, I'm a cancer patient at your hospital, and this produce that you're giving me is going to allow me to live a little bit healthier, maybe do some juicing and give me a little bit more hope. I think there's a part of me that says, okay, yeah, the Band-Aid was necessary, but then what? How do we address the systemic issue of why are there so many people hungry, going to bed hungry at night in a nation where 40% of our food production goes to waste, goes to a landfill? So we have this paradox of food waste, significant food waste, and then people going hungry. I mentioned the pandemic. We have communities where, some of us might not know somebody close in our family who died. In the Latino population in California, the life expectancy was reduced by 6 years since the pandemic in the last 3 years. In the Black community, by 4 years. The national longevity has been reduced because of the pandemic. So I think we need to really ask those why questions. Why is it that in certain communities are bearing the burden of our statistics that's affecting all of us? And then there's another book, Saúl, The Sum of Us by Heather McKee, an amazing book on racism in America and how she's an economist. So she approaches anti-racism from an economist point of view. And Heather says, we have these racist policies that we think are only affecting communities of color, but they really affect all of us. And she uses public swimming pools as an example. and how because of racism, a lot of public schools were or public swimming pools were closed because they didn't want their kids swimming with those kids. And because of that, now there are entire communities that don't know how to swim unless you have a pool in your own backyard. But the middle class, the white middle class really, or lower middle class, working class, lost their public swimming pools because of that. So it's the sum of us, how, racism affects all of us. And I think that's the next piece, is not just understanding why of the disparities, but understanding the disparities affect our entire community, not just parts of it.
And I just want to add, I know I emphasize the importance of an individual constituent, but there's so much power in health systems or church or faith communities coming together and rallying behind a policy, So just want to throw that out there for all you leaders.
Political capital.
Just a closing, comment. We are Seventh-day Adventist as an organization, and that's an organization much like many of the ones from which you come. That word Adventist ought to make us think about what Jesus had to say about the Advent. If you go to Matthew's Gospel, Matthew 24 and 25, his most extensive words about his coming, about what would precede it, about how to prepare for it. The last statement he makes, we often call it the parable of the sheep and the goats, is a powerful statement that describes the heart of those who are living in readiness, in daily readiness for his coming. And the simple reality is they are involved in meeting the simple and the basic needs of others. That's just their life. It is what they do, so much so that when they discover that they were doing it according to Jesus, to him, they said, we had no idea. That's just how we lived life. And that means they were living in readiness for his coming. It's very curious when he makes his final statement, his bottom line. He doesn't talk about doctrine. He doesn't talk about church structure. He doesn't ask how many great controversies you passed out. He just asks, did you care for the simple and basic needs of those around you? I want to thank our four presenters so much for all that you did. Carl had to step away, but Linda, JC, and Wonha. And I want to thank in a very special way my colleague, Saúl Barceló, who did the lion's share of the work in setting up for this session today. I just sincerely appreciate them and thank you for all that you've shared with us. We're going to close with just a brief word of prayer. Thankful for this, helping us to go out empowered to implement it, and then thanking God for the food. Gracious God, thank you for what we've heard, for the things that have enlightened us, for the ones that have challenged us, from the ones from which we have learned. Lord, don't let it just lie here on these tables, but let it take root in our hearts and souls and grow and bear fruit for the good of others and for the good of the kingdom of God, which is about reaching out to others in the real situations of their lives. So bless those who presented, those of us who took it in, and thank you for the food from which we'll partake. In Jesus' name, amen.